they're in the syllabus. If you don't miss any classes, and this first week, because I didn't say it, is a gimme. So if you missed a class this week, don't worry about it. But from here on, if you don't miss any classes, at the end of the semester, you get a 1% bump to your grade. So it really only matters if you're on the cusp, and you don't know if you're on the cusp of like a letter grade until the end of the semester. But this is my way to encourage you to come to class because A, it helps your grade, and B, if at the end you have like an 89.2 and you want an A, I'm not just going to give it to you. But if you didn't miss any classes, you get a 90.2. If you only miss one class, you get a 0.5% bonus. So it still helps you, even if you have an 89.2, that'll bump you up to an 89.7. And that rounds up to an A. So that's the only two scenarios, if you don't miss any classes or if you only miss one class. So a 1% bonus or a 0.5% bonus. Does that make sense? Yes.
What if you miss for sports?
If you miss for sports, it's excused and it doesn't count against you. So it's not really an absence. Good question. Or if you're sick and you have a doctor's note, that's fine too. I totally forgot to mention that, sorry. And then the other thing I emailed you guys about was the study guide, which seems way ahead of schedule, I know, but the exam one study guide I put up. And I thought more people were asking kind of what sections of the chapter I wanted you to outline. And I realized there is so much in the book that I'm not going to go over, and I don't want you to, it wouldn't be a waste of time. You'd learn it, but I don't want you to spend more time than you need to. These are the topics that are going to be on the chapter 1 part of the first exam. And then you have 2 and 3 below as well. So I have all these made already. So I figured I'd just go ahead and post basically a very basic outline of the information to focus on in your outline. Does that help? Okay, if you'd rather just do everything or do all the sections in the book, that's fine. I'm not saying you have to stick to this, but this kind of narrows down what I will be talking about and what I'll be asking about on the exams. So I'll do that at the beginning of each unit that we start. So 1, 2, and 3 are the first unit, chapters 1, 2, and 3. They're all up here. Now you know what to focus on in the textbook. Any questions about the outline? Okay, I'll be grading those today / over the weekend, giving you any comments back. If you haven't turned it in yet, don't forget to turn it in. You'll upload it to Canvas. Okay, those are the 2 main things I wanted to mention before we get back into the chapter. All right. Give me a second here while I get it up and going on Zoom. And I am, every time I Zoom, I think I said this, I'm recording the classes that I Zoom. So there's a link on Canvas as well if you ever want to go back. I won't Zoom every class if everyone's here. I won't Zoom, but you'll have some recorded classes in case you want to go back if you missed something. Okay. There. We went through all the organ systems, and most of you guys have had lab, right? Some people have lab today, I think, Friday afternoon. But most people by this point have had lab, so you've seen these terms already. Oh, who asked me about the fever, shivering? Yeah, so I looked it up. That was a good question. That's what else I wanted to mention. So when you have a fever, you shiver. The whole reason behind that is because your body actually resets its ideal temperature higher. So instead of like 98.6, it'll set it to 101, like your internal temperature. And you shivering is helping your temperature get up that high. Yeah, I didn't know that. So that was a good question. Yeah. So it resets that set point. Rather than 98.6 being the point at which your body wants to stay, it'll reset it to like 101. And the shivering, yeah, like I said, helps get the body temp up. Good question. Thank you. Okay, mapping the human body regions. So in lab, if you haven't had it already, or if you have had it, you realize there's a lot of terminology that goes along with human anatomy. So we're going into some of the basics, kind of a roadmap of the human body. terms that will come up again and again, both externally and then the internal body cavities we'll talk about as well. So most of this, if you've had lab, you've kind of heard already. So hopefully it's sort of a review. I'm going to run through these terms. It's not a very exciting slide to go over, but then I'm going to have you guys kind of quiz yourselves. So pay attention, kind of take in as much as you can. It's easy to just kind of lose focus on this topic and on this slide, but as I'm going through this, kind of write down a way for you to remember what these different terms mean. Like I said, this will come up again. When we talk about the femur, which is the upper leg bone, that's in the femoral region. So the terms come up just in slightly different ways. So you'll see them again. Okay, so I'm going to run through this. There's some slightly different terms than your lab manual, which is really annoying. But like I said before, you'll see this throughout anatomy and physiology. There's kind of sometimes there's two words for something, or they'll be pointing to slightly different areas. If there's anything confusing like that, I'll try to point it out. But it's just something you deal with in human A&P. It seems like it should be one word for every single body part, but sometimes there's an older word and kind of a newer word. If you need to know both of them, I'll tell you. If you don't need to know something, I'll tell you that too. So definitely take note of that. All right, we're going to start at the top on the front side of the body. Cranial, this is really tiny. Cranial refers to the skull specifically. So cranial, that's pretty straightforward. The forehead is the frontal region. The eye is either orbital or ocular. You want to know both of those terms. Orbital, ocular, they're used interchangeably. The cheek is buccal. I don't know where that comes from. B-U-C-C-A-L. It's a weird term. Mental is the chin. Mental you usually think of as like, your brain, right? But the mentum is the chin, like the lower jaw. So mental. Oral is the mouth, nasal is the nose. Boom, those are two really easy ones. It is listed over here. So I'm going to talk about cervical is the neck area. So cervical is obviously between the head and the shoulders. The thoracic region is just generally the chest overall. So thoracic, specifically the breastbone in between the two pecs basically is called sternal. The armpit is axillary. So we'll see axillary when we get into the integumentary system because there's axillary sweat glands. Obviously you sweat from your armpit. So we'll learn about those. Brachial is generally, I think, the whole arm. Here it's listed as kind of the upper part of the arm, but brachial really refers to the whole arm. The forearm specifically is the antebrachial. Anti means ahead of. So antebrachial is only the forearm. Brachial would kind of be the whole arm itself. What else? Acromial is the shoulder. I went over that in lab. So specifically kind of that turn from the collarbone into the arm is acromial. Abdominal, the abdomen, super easy. Specifically within the abdominal region, you have umbilical, which is the navel area, the belly button. What else am I missing? Okay, down towards the pelvic area. Coxal is the hip, so that's going to be right on the side of the leg. Coxal. Pelvic is across the front, so kind of the main part of the lower area of the abdominal region would be pelvic. Inguinal is the groin area just below that. Oh, sorry, pubic region is just below that. Inguinal is off to the side. Iliac is another term for the groin area, which will come up in the abdominal region slide. But inguinal is typically in this overall regions of the human body used a lot more commonly. Sorry, back to the arm. We have antebrachial. The wrist is carpal. So if you've heard of carpal tunnel syndrome, where your wrist kind of starts to hurt, that's the carpal region. Palmar is the palm. Digital or phalangeal. So these are your phalanges, both fingers and toes. So digital is for fingers or toes. Phalangeal, fingers or toes. The thumb specifically gets its own name. It's pollex. I won't really ever use that all that much, but you want to know it. All right, we got the pelvic region down into the legs. The upper leg, the thigh, is femoral. The knee is patellar. So your patellar bone is the knee bone that you feel right on top of your knee. The lower leg, the front of it, is referred to as curl. That's really hard for me to say. It's an awkward word. We won't really ever use that word. You want to know it, but it's not commonly used. Curl, and then the back is surl, the calf. Tarsal is going to be the ankle. So you have the wrist, kind of the connection between the hand and the arm is carpal. The connection between the foot and the leg is tarsal. And then again, like I said, phalangeal or digital. Those are for both fingers and toes. All right, the ear we didn't talk about. I don't know why it's on the back, but otic is for ear. Cephalic overall is the head. I would say cranial and cephalic are kind of interchangeable. The overall back area is dorsal. The lower back is lumbar. And then your tailbone is the sacral region. So sacral, just right above the butt. The butt area is gluteal. Gluteus maximus is one of the big muscles that you'll learn there. There's actually 3 gluteal muscles, but that is generally referred to as gluteal. The back of the knee. The back of the knee has its own term, which is kind of crazy. That is popliteal. I like that word. I ask about popliteal a lot. So no popliteal, it's just the back of the knee. The heel down here, calcaneal. Pedal generally refers to foot. Manual refers to hand. So manual is the hand, pedal is the overall foot. And the plantar region of the foot is the sole of the foot, so the whole sole. What did I miss? The elbow. So just like the front of the knee and the back of the knee, you have patellar and popliteal. On the elbow, you have the front is antecubital. That's where blood is drawn from. If you ever have blood taken, the antecubital region. The elbow, like the bony part on the back, is olecramal. Where's that? Olecramal. If you don't know how to pronounce these, don't stress about it. It's okay. You want to be able to identify the words and label a diagram with them. Okay, questions about any of these? Differences from lab? I know we mentioned a few different ones in lab. Okay, not the most exciting topic, but it kind of is the map of the human body, and they'll come up again, most of them. Okay, so now we're going to take a break, and you guys are going to put your notes away and try to fill in as many of these as possible on another diagram. What? No, it's not for a grade. Sorry, I didn't mean to give you guys a heart attack. Good. So I have a slightly different diagram here. Some of the lines are pointing to slightly different places, so don't stress about it too much. What I want you to do is really don't use your notes and work independently at first. So once you've filled out, I should probably write the terms up here, shouldn't I? Oh, I should have printed them out. Okay, I'll start writing the terms up here and you guys can start to fill them in. Try to remember as many as you can. And I think I like doing this because then it makes you realize how few, or maybe how many you know, but how few you know. I know we just went over them. You did an outline, so hopefully you kind of covered them. Fill in as many as you can on your own. And then once you're done, like legitly, you can't do any more. You can work with someone else next to you. Like I said, this isn't for a grade. So it's really to help you realize what you know and what you don't know. Make a star next to the ones you don't know, so you go back and focus on that when you're studying for the exam. So before I have the labels written up there, you can remember, or the names, you can remember any without the names, fill them in. The upper thigh, the thigh is easy, if you remember that one. So yeah. All right, this is what I have labeled on this diagram. Like I said, it's a little bit different. We've got nasal, oral, buccal, right? Cervical. If you spell them wrong, don't worry too much about it. Orbital / ocular. So start filling those in as best you can. I'm kind of generally writing these in the order like top to bottom of body, so if that's helpful. For you guys on Zoom, sorry, I uploaded a blank. I think, oh no, I didn't. I'll upload the blank version and you can practice it too. Sorry, guys. Lots of terms. There are some additional lines on this that don't link to anything we just talked about. So if you don't know those, that's fine. And before you start working with someone else, do this earlier. Okay, I think that's most of them. Before you start working with someone else, count up how many you've got on your own. Kind of make a note of that. All right, so you guys on Zoom, I'm going to go ahead and upload this blank version. You can practice. Okay, so for those of you on Zoom, you should see a body regions _ blank file. And that's what the class is using. you're getting stuck, go ahead and work with someone else. See what you can fill in. Without going to your notes yet, because other people will know, you know, some blanks that you don't know probably. No, it's not on that. It's in that. Oh, okay. Yeah. I think that's.
Oh, okay.
Yeah.
Okay.
Okay, but no more terms. I just wondered where they got.
Okay, all right. I just
You're
wanted
good.
to-
Yeah, next job.
So how long did you celebrate?
On Monday, I stayed up till like 1.
I was wondering if you were gonna be here Wednesday.
Yes, I didn't celebrate that hard. I still, yeah, I teach Tuesday morning at 9:30, so I was sleepy.
I
But
said, I need to, I said.
did you
we're
stay
too
up?
late.
yeah, I never
2
stay up that
o'clock.
late. 2?
I said,
Wow.
yeah.
Man. Yeah, I think I'm still feeling it. I think I finally caught up on my sleep
Me too.
as of last night. Are you going to the parade?
No,
No.
yeah.
We're gonna try, but it's gonna be insane.
Well, I was wondering how loud Athens was.
Well, yeah, we live kind of a little ways out, so we were like, I feel like we should do something, but we're
Yeah.
old and we have a kid, so we're just gonna stay here and watch the ceremony. But yeah, downtown was insane. Yeah. Okay, let's fill in some of the blanks that you guys are having trouble with. So I'm not gonna go through them all, but let me know which ones you guys can't figure out. The back of the head, we didn't talk about on that diagram, but in lab, it's occipital. So, occipital. So that's in your lab manual. That's why you didn't know that one.
Shoulder one, the posterior shoulder. one?
This one, that's acromial.
So then what's the shoulder?
I think that's acromial too. I don't know why they mentioned it. I don't know why they have, I don't know. This diagram, I'm not totally sure, but there's nothing else there you need to know. So those are both acromial. So that would be acromial. Wonder if I can write on this. Sometimes this this thing doesn't always work the best, but let's see. Let's see if I can. Oh, wait. I can usually do it in PowerPoint. Okay, see if this works.
I think it may. It has a little.
Yeah, sometimes it's just, I write and it's like way off. Not the best. Oh, sorry, that's not even occipital. Yeah, it just doesn't, it's not like accurate. It's so annoying. I look like I can't. Acromial. That doesn't work the best, but. What else did you guys get stuck on? The pelvic region's kind of tough.
What was Cyril?
Sural is the calf, the back of the,
Oh,
This.
okay.
that's sural.
Then what's the back of the thigh right there?
I think that's also femoral. So femur, femoral, again, there's, yeah. Because there's nothing you need to know for the back of the thigh. So just label that as femoral.
Then for like the back, is it like, is that first one dorsal?
This one,
Yeah.
that I think is referring to the scapula. So it's scapular, but that is also one that I didn't mention on that diagram. But you have it in lab. So scapular would be that one. See if I can write it in. Okay, scapular. Yeah, those are tough. So let's see if I can write it in. This one is going to be pelvic. So the one kind of right under the abdominal region is pelvic. Sorry, that's pathetic. So pelvic, I think on the sides, those are coxal. So that's for that one. So on the sides of the legs, those are the hips, coxal. And then this is going to be inguinal and pubic. So inguinal, the groin. Oh my gosh. Sorry, it does not work well. Inguinal is here below the pelvic, and then pubic here. Okay.
Where does auxiliary go?
Axillary?
Yeah.
Axillary, that's okay. It's the armpit. So is that, I don't think they even have that. Oh yeah, right here. That's axillary.
Oh, on the back.
Uh-huh.
Right? It's the little like triangle on the lower back.
Sacrum, So that's your tailbone. Sacrum, it's the very bottom of your spine, basically.
I forgot about the back of the leg.
Mhm.
I know,
Like the upper leg?
the lower leg.
Oh,
What was that?
The lower leg is sural, S-U-R-A-L. Sural and curl. I can't say those words very well. I don't know why they're so hard.
And then the back of the knee is up to.
Popliteal,
Is the line pointing to the calf?
No, the front of the calf, annoyingly, is something else. It's curl. This one. C-R-U-R-A-L.
What's the other one right there?
That one is, I think also one that you didn't need to know for here. It is fibular. So, yeah, fibular. So the fibula is the bone on the outside of your lower leg. That's in your lab manual. Yeah, Ashley? The two chest ones, yeah. So the one in the middle, this one, that's sternal. That's your breastbone. And then this one would be thoracic, just generally thoracic.
Okay, so that lower back, so it's like, I mean, the top, the neck, cervical, the lower, the back is lumbar. And I feel like it's the very, very bottom of that is what? Is it the vertical integration?
This one right here, that's sacrum.
Sacrum, no, not that one, but like, 8, 12, and 6, that kind of, okay, so it's cervical, lumbar.
Oh, the
and-
spine, cervical,
That's
thoracic,
what I mean.
cervical, thoracic, lumbar, sacral. Yeah,
There.
yeah. Yeah, so those are just different regions of the spine, which we'll get into when we talk about the skeleton. Yep. You have cervical vertebrae, you have thoracic vertebrae, lumbar, and sacral. Yeah. So this, I think, would be, I think they're referring to lower back. So this would be lumbar, this general region. And then this would just be dorsal or spinal. I don't know. I mean, oops, it's dorsal. Okay, on an exam, I'd be very specific and you would know what I'm referring to. And if you're not sure what I'm referring to, always ask me, because I can kind of describe exactly what I mean without giving you the answer, I guess is the best way to say that. Any other ones that you guys were stuck on? Sorry for that terrible writing, but hopefully it's helpful. Okay. Cool. So I did upload the blank version of this. If you guys want to practice with it, you can print more out. But as of now, we will move on to the next set of terminology. Good job, guys. All right. Human body cavity is not nearly as many as the previous set of terms. And we went over these in lab as well. I don't think there's a whole lot different than your lab manual here. These are just cavities that we'll be focusing on and referring to. So again, yes.
With the, like, a test of the exam, do we just need the like thoracic cavity or the other?
The others also, yeah. So all the detail in here. So thoracic is overall the chest. Good question. But I also want you to know the superior mediastinum and the pericardial, which is in the thoracic cavity. So you want to know all these terms and be able to, if I have a line pointing to this and just a blank here and say, what is this? That would be pericardial. Yeah, good question. So you want to know all these terms. Like I said, I'll just be referring to them. So from here on, I'll just assume you know these when we're talking about, oh, this organ's in the thoracic cavity. You'll know, okay, that's the chest or abdominal or pelvic. These are pretty, I think they're way easier than all of that terminology for the mapping of the human body. So starting at the top, you've got cranial and then spinal. So the cranial cavity houses the brain, obviously. Spinal cavity houses the spine. I'll go over kind of the big chunks first and then the details within them. So the thoracic cavity is the chest. Within the thoracic cavity, you have the two cavities with the lungs. Those are the pleural cavity. So one lung, two lungs. Plural always refers to something dealing with the lungs. The heart is in the pericardial cavity here. Peri means around, cardial refers to heart, so it's around the heart. And then this weird one above is called the superior mediastinum. We don't really need to know a whole lot more about it, but you need to know that term. The diaphragm listed here is kind of that's the muscle that helps you breathe. So it is the dividing line between the thoracic and the abdominal cavities. So here we have, if you chunk all this together, it's the abdominopelvic. If you just take one at a time, it would be abdominal and pelvic cavities. So a lot of times they're just lumped together because there's not a huge division between the two. So you want to know abdominal, pelvic, as well as abdominopelvic cavity. Questions about that? All right, those are the cavities. Now the abdomen. The abdomen. We like to divide it into 4 quadrants or 9 regions, just for fun. The most important part here, and I said this in lab, the right and left is the patient's right and left. So we're looking at this person. This is her right and her left. It's not your right and your left, right? So it's the patient's right and left. That's always the case. So if we're looking at the quadrants, super easy, right upper, right lower, left lower. Pretty straightforward. I'll mostly be focusing on the 9 regions and ask you guys to identify these because the 4 quadrants is pretty simple. Okay, so the 9 regions, I went over these in lab. I'm sorry if this is repetitive, but I want to make sure everyone's on the same page since there's 2 sections that aren't mine in lab. We have the hypochondriac regions on top. So I'm going to go down the sides first. It's easiest to explain that way, then we'll go down the middle. So the hypochondriac, hypo means below. So we have hypo here and here. So these prefixes and root words sometimes help you figure out and remember what you're talking about. So I'll point them out. I'm not going to ask you to define them, but they might be helpful for your memory. So right hypochondriac, that means the right side of the body, the patient's body below the ribs. Hypochondriac refers to ribs. So it's up there under the rib cage. Same with the left hypochondriac. Lumbar, lower back, you already know that. So the lower region, but we're on the abdominal side. Right lumbar, left lumbar. And then iliac. So iliac and inguinal are used very interchangeably. So we have right and left iliac listed here. Iliac is going to also be the same as right and left inguinal, which is the groin, which you guys know already. So make note of that. You need to know iliac and inguinal. Those are definitely used, I would say, maybe depending on what you're talking about in the body, but they're used very interchangeably. So that's the right and left. If you know the right side, you know the left side. You just have to be able to separate which is the right and which is the left. If we go down the middle is really easy. Umbilical, it's where the umbilical cord was attached in utero. Epigastric means above the stomach. Epi is on top of, gastric refers to stomach. Hypogastric, below the stomach. So epi on top of, hypo below. Those are the 9 regions. Again, I'll have a diagram and say, what region is, say, this? And you would say, that's the right lumbar. I will also give you left lumbar as an option. So you definitely want to know the right versus the left and keep those straight. Questions about abdominal region? Okay, we're not going to go into the organs that are in each one. I know in lab we talk about that, but we're just talking about the regions for now. Directional terms. All right, these were also in lab. Who hasn't had lab yet? Great, awesome. I swear there's a Friday section. I don't know who's in it. Okay, so everyone's had lab, so you've seen these terms, right? I'm going to go through them fairly quickly, just as a review. It'll be a nice review seeing them twice. You can ignore cranial and caudal for these purposes. Just superior and inferior is what I use. So superior is above, inferior is below. As a reminder, all of these directional terms are just relative to each other. So you're talking about one body part in relation to where another body part is. So the head would be superior to the abdomen. The head is above the abdomen. Proximal distal is the one that usually gives people problems. So proximal and distal are only used on the limbs for the most part. So your arms and your legs. Something that's proximal is closer to the trunk of the body. So closer to the attachment point of the limb. Distal is further away. So the hand would be distal to the elbow because the hand is further away from that connection point compared to the elbow. Let's see, anterior, posterior. You do want to know these synonyms, ventral and dorsal. Anterior is towards the front of the body. That's also referred to as ventral. If we were animals who were on all fours rather than upright, that refers to kind of the stomach area. Posterior, dorsal, those are synonyms. It's the back of the body. Dorsal is easy to remember because like a dorsal fin on a dolphin or a shark, it's on their back. Proximal, distal. I think the last ones, lateral, medial. So if we divide a person down the middle, something that's lateral is further out from that midline. Something that's medial is towards the middle. So that's we usually say that in relation, or I'll use examples from the face. So the nose would be medial to the ear. Questions about those? I know I went through those quickly, but you've heard that already, so I don't want to bore you too much. Good. All right. Oh yeah, and here I have, I'm not going to go through these, but there's, if words help you, like definitions rather than just a diagram, I put all these in here. Superficial and deep, I didn't mention. You want to know those two as well. We talked about those in lab. Superficial, closer to the surface of the body. If we're talking about like the skin versus internal organs, that's what I'm talking about there. Deep is something that's further in the body. So muscle would be deep to the skin. So those are there for sort of your reference. Oh yeah, and examples, some good examples, that's helpful. Planes, we also did this in lab. So we can divide the body into basically 3 planes. You have the transverse, that's kind of the easiest one. If you just cut an organ or a person, it's weird to think about it's cutting a whole person, but mostly it's when we're looking at internal pieces of organs, you can cut them in these different sections. So transverse section or transverse plane is parallel to the ground. So you're cutting it parallel to the ground. The coronal or frontal section. So you want to know both of those terms. You don't have to know horizontal. I don't ever use the horizontal plane, just transverse. Coronal or frontal is if you cut something kind of down the middle, so there's a front and a back as a result. And then sagittal, I'm really only going to focus on mid-sagittal here. Sagittal is where you cut someone down the middle, so there's a right and a left. Mid-sagittal is technically right down the middle of the body. You can do a sagittal section off to the side as well. But just know mid-sagittal, coronal/frontal, and transverse. So if I showed you a diagram like this, you'd be able to tell me what plane is being shown. Oh, and this is just some examples. Like I said, we don't really cut an entire, I mean, you can cut an entire human being, I guess a cadaver if you wanted to, but typically we'll look at different organs, different pieces of the body with different sections. You can see different characteristics. So that's just an example. You don't need to know these, but if that's helpful for you to understand why we're talking about these planes, we'll be cutting bones and muscles. Well, we won't be cutting them, but we'll be seeing sections like this. So you can see these different features within. Okay, and then this kind of wraps it up. So I do want to talk about precision. So I mentioned, I know spelling is tough. These are strange words. It's hard to pronounce them. But I just wanted to take a minute to talk about why it's important to be precise with terms and spelling. So as you're working on these, try to learn the spelling. Obviously, as you progress in your academic career into your eventual healthcare career, you'll get better at the terms that you really need to use spelling wise. A lot of terms are really similar, but can have really different meanings. So they might sound almost exactly alike, but they have different meanings. That can come into play in a large way when treating a patient. I'm sure you can think of examples, but you have to be precise when you're referring to something. Just for an example, the right and left. So if you're a surgeon and you, hopefully at that point, you know the difference between the right and left of the patient versus yours, and you have to perform a surgery on like the right hypochondriac region, you don't want to cut the patient open on the left, right? Thinking, oh, it's my right. That's a very simple, basic example that's probably, hopefully, doesn't come up that often. But being precise and understanding exactly where these pieces are on humans is very important. It's all about safety and patient safety. We're going to watch this quick, sad story about precision. So get the tissues ready. I think this will work. Why it's important to be precise. Something that seems like not a big deal can cause some pretty major issues. Hopefully I have sound here.
My daughter, Emily Christine Jarrett, was born February 24th, 2004. She was playing in the backyard with her sister, Navy Catholic, and I noticed that every so often, Emily would stop and grab her side and after witnessing this occur 3 or 4 times during the course of the afternoon, neither one of us as parents really thought much of it, but we knew that we needed to take her in to have her checked out. We took Emily to a leading pediatric facility in Cleveland, Ohio, and they had decided to run Emily through the MRI scan. And it was a grapefruit-sized mass in Emily's abdomen. They prepared us to expect the worst. They set our expectations, expect that your little girl's going to lose a significant amount of weight during the course of treatment. She's going to lose her beautiful blonde ringlets. She'd be vomiting most likely and things of that nature. She didn't start losing those beautiful blonde ringlets of hair until January of 2006. But I knew in the back of my mind that quite possibly the tumor wasn't responding to that course of treatment. So the decision was made to run Emily through the MRI scanner again. Emily's tumor had completely disappeared There wasn't even any residual scar tissue remaining in her abdomen that they had anticipated. A miracle had occurred. And those are the caregiver's words, not mine. At this point, they recommended one final round, 3-day round of chemotherapy, just to make sure that there wasn't any residual cancer cells remaining. I arrived about 10 or 15 minutes after they had started Emily's IV that day. And when I walked into Emily's treatment room, Emily was unconscious. I was thinking to myself, how could this have happened? I mean, she was just fine. What was found to have happened was the clinical pharmacy that day ran out of standard bags of saline with 0.9% sodium chloride. And so this young pharmacy technician decided to take an empty compounding bag, and she saw 3 vials of what's called hypertonic saline, which is 23.4% in concentration. She filled this empty compounding bag with those 3 vials of hypertonic saline and used that as the base solution for Emily's chemotherapy that day. She thought she was doing the right thing. That Wednesday was when my wife and I had to make the most difficult decision of our lives, which was after multiple EEGs showed little to no brain activity. The decision was made to take Emily off of life support. That day is still a blur to me emotionally. I was packing some of Emily's things from her treatment room into the back of our SUV, which happened to be parked on the top floor of the parking garage at the facility that day. And I saw the car seat in the back of that SUV. And I was thinking, you know, maybe I should just take a flying leap off this parking garage and go and join my little girl. I had never had those kind of thoughts or feelings before in my life. And it was almost at that moment that I decided to embark on this career. I don't want to say that it was chosen, that I chose it. I believe it was chosen for me. And work so passionately on through my advocacy efforts to try to find or be an active part of the solution to preventable medical errors. And so in striving to be part of the solution, I've been working very hard through the programming of the Emily Jerry Foundation.
Sorry guys, I don't like to pass time. So that's just an example of something that seems like a minor error causing. Yeah.
Really just the thing.
Oh my god, I like that here every time I know.
No.